Okay, thank you, Cha. Good morning, good afternoon, good evening, all colleagues, attendees of this webinar. It is very happy to welcome all you all in this webinar. This webinar is one of the important steps in our um, our way to continue on the achievement of universal health coverage that's already mentioned as part of the SDGs. Within the process to implement UHC, I think the most important is how to provide environment for learning. Indonesia, among the countries that already implement universal health coverage, uh, also a country where many other countries also come to our uh, UHC ecosystem to learn. Even, for example, our students, we would like to learn also how the system works. But the problem is that the system is very complex and it is not easy for students to learn in the field. On the other hand, there was OpenIMIS, an open source platform that could be used to be not only the tool for health insurance system, it is already implemented elsewhere in the world, but also in our case, in Indonesia, we would like also to use this OpenIMIS as a mini health insurance system, but uh, mimic or how we can say it is the model of how the Indonesian health system in the reality. But to make open image as part of the model, we need to learn from the field. This webinar actually part of the previous webinar that we have been conducted before in the open English community. But currently we are in our AeHIN community, in which we would like to explain the progress that we had so far, including the mapping from the Indonesian health system, Indonesian health insurance system in with OpenIMIS, and then our step to develop what we call Open JKN, Open Health Insurance National Health Insurance System in Indonesia, into an open source platform that could be used for learning. I think without further ado, I would like to invite Mas Kuku to start with the presentation and then continue with Mas Lukman and Annisa. Thank you.
Yeah, thank you, Cha. Good evening, everyone. AeHIN members, thank you for joining our presentations. Entitled Sandboxing's Open IMIS for Universal Health Coverage, particularly how to adopt this into our Indonesian context for learning, suppose. And as Pak Anies mentioned that there will be three presenters, and I will be my presentation would be related to the why we propose the open JKNs. We call it open JKNs, as Pak Anies mentioned, and because there are several reasons why we need to have this kind of the a module or probably plugins that can be expanded from the OpenIMIS, because there are several, based on our findings, several business process and also availability of variables not uh, yeah not available at current OpenIMIS. So that's why in the second presenter, Lukman will present about how the adoption of the open image into open JKNs. So far, we call it open JKN. And before we continue, I think probably that you are aware that Indonesia is one of the huge country, and currently we have social health insurance participants more than 98%. From the around 270 millions population, I guess, and supported by the more than 32,000 health facility that collaborate with our social health insurance, BPJS Kesehatan. And from the latest presentation, we know that the daily data transaction have reached nearly 500,000 per day, and that connecting all the health facility, payment mechanisms, and employers and other key stakeholders. And with regard to the OpenIMIS or OpenJKN. Basic. Yeah. Hi. Sorry. For bad connections. Yeah, let me continue about yeah, we have to come back to the outcome that we have to achieve in the universal health coverage, and according to the several reference, we have to see the population coverage, service coverage, and financial protections. And the other studies mention about the health system strengthening as a part of the purpose of the universal health coverage. So any business process that we have to develop in within the digital health should be answering these outcomes. But we have to little bit more details. For example, like financial protections. According to the reference, the financial protection is related to the populations to avoid the economic catastrophic because they are sick. But now, I think the financial protection is not only for the population, but also for its health organizations, either the hospital or maybe the health insurance itself. Because in many, yeah, in Indonesia context, deficit is one of the issue related to the financial protection for the health insurance organizations. And yeah, when we're talking again with related to the digital health for social health insurance, and we have yeah, two key considerations are essentials. One, who are the main stakeholders, and the second is what are the business process to facilitate this main stakeholder. For example, like population or participants or health insurance participants. Of course, they need the business process related to the registrations or premium payments or administrative process and probably help desk. And for the health facilities, it's related to the health care facility registration, contract management. In the perspective of the health insurance, it's essential to have credentialing of the health facility or re-credentialing of health facility, or to um, evaluate the performance of the health facility to determine the performance-based capitation, especially for the primary care. And for the regulation or community like university or NGOs, monitoring of health system performance is essential, where data analysis should be used to provide the evidence of the impact of the universal health coverage in the health systems. And this main stakeholder, if we look, oops, sorry, if you look at the these actors, there are several potential data transactions amongst these stakeholders between participants and health insurance, for example, for premium payments, between participants and healthcare facilities. For example, if we implement the telemedicine or teleconsultations to access to healthcare, or between the health insurance and health care facilities, for example, for reimbursement claim and capitations, and sums related to the fraud detections following the need of the health insurance organizations. And let's us take a close look at the potential data transaction between, let's say, that health insurance and participants. And from this perspective, participants managements and premium payments are the core business process that rely heavily on the digital technology. And in the perspective of the health insurance, for example, they provide the health facility informations and availability of services that can be registered by the participants to submit or to admit in the certain health facility. and probably developing the mobile apps to provide the easiness of administration processes for the participants. And premium payments and registration and administration are the core of the process business. If you want to link between the health insurance and participants, and for all the transactions should be answering several indicators. For example, like the percentage of population coverage. This is the one of the slide that we present earlier, and 98% of the populations are already covered by health insurance. But as that, this is not only that, but for example, like the percentage of the active participants who regularly pay the premiums for the insurance is also very important, because it's related to the financial protections, and not only for the individual but also for the organizations, hospitals or health insurance. And similarly, I think data transaction between the health insurance and healthcare facility, the key business process could be facilitating credentialing, contract management, claim reimbursements, and depends on the technology to operate to make it operate efficiently. And some of indicators that can be generated from this kind of the transaction could be the like health facility utilizations, quality of patient cares, percentage of non-specialistic patient referrals, or others related to the managements of the patient care between the health facility, for example, like referrals. And the others process business between the health facility and participants, as we mentioned earlier, that patients or participant can seek the health facility, the equipment or their services that are provided, and even several health facility provide the teleconsultation between the not only between the participant to the healthcare provider, but also between provider to providers. In some case, in Indonesia, the provider to provider has been piloting in several districts under the schemes of the social health insurance. And several technology like electronic medical records, online appointment, personal health records is several of the digital health that facilitate the process communications or process interaction between the health facility and participants. And of course, this data transaction should be answering several indicators, for example, like percentage of pre-admission, patient satisfactions, or self-referrals, contact rate, or many others related to the outcomes or output of the healthcare services under the universal health coverage schemes. And yeah, the other thing that we would like to share is related to the evolving digital health transformation, because this more or less will impact how the digital health is developed and adapted into the social health insurance context. In our digital health transformations, the ecosystem or the health insurance is part of the bigger ecosystems of digital health. And several policy, for example, like using the interoperability, using FHIR, for example, using the terminology standard that adopted in national levels, or adopting several use cases related to the programs, health program services, specific program services. For example, like HIV, TB, malaria, maternal and child health should be elaborated into the healthcare services that more or less will impact how the digital health will be used in the health facility, and also how the health insurance can comply with this kind of the standard. Now, our yeah study or identifying the potential of OpenIMIS, showing that not all this process business available in OpenIMIS. And the second is I think for 40%, more than 40% of the variable that needed to accommodate several business processes not available in the OpenIMIS. And for example, like participant type, eligibility, facility types, and etc. And evolving of digital health transformation, including the use of the terminology standard, fires, and how this change very quickly. And this is that we need to consider because it's not matures at the moment. So uh, that's why we want to introduce open JKNs to avoid the destruction of OpenIMIS. We want also to leveraging the data analytics for monitoring and healthcare services, including the algorithm for fraud detection, supporting research and innovation initiative, for example, like introductions AI into the schemes of the social health insurance. So that's why we try to make additional modules plugin, which is not uh, what disturbs the existing OpenIMIS frameworks. And this is the we Pak Lukman will explain more about this, but basically how the Open JKN can be additional module that facilitate the real nearly at least nearly uh, similarly to how social health insurance in Indonesia, the process business of social health insurance in Indonesia, and using the fires and how common data interoperability between one to a system to another, and how the data also can be used by the participants using the personal health record, for example. This is kind of the several business process that we try to adopt into the OpenIMIS. So I think this is my last slide, and Pak Lukman would like to hand over
Okay.
to yeah.
So yeah, I think already said by Pak Kuku, there is a complexity or maybe like issue in when we do the adaptation. Yeah. So there is some internal issue. For example, that's okay. So for example, we can make the open image as change to our language, Indonesian language. But however, some part is not appear. For example, like administrative menu, even though or now is already come up, but I think there is still complexity in this kind of the uh, menu arrangement, and also there is some also in data incompatibility. For example, we also identify that only uh, how to say 31%, for example, this is only for this enrollment part. Yeah, 31% is already support by open image, and another 69% is not supported. And also, for example, another level is another data is about only 41%. Yeah, while the uh, 58.7% is not mapped to open image. This is one of the sample that we in the enrollment module. So I think we don't finish yet, but I think there is another how to say another incompatibility. later we can find for this case. And another issue, as Pak Gugu said also, there is not an internal issue but also external issue. For example, there is a complexity of the JKN ecosystem itself. So, for example, if we have like a bigger picture of the JKN ecosystem, our national health insurance system, there is a lot of system, there is a lot of application that support our ecosystem. So, national health insurance in Indonesia is not consists only one system, single system, but several various system that not maybe we can say not interoperable or not interact with each other. So that's how this is how what kind of this our complexity of our system. This is one of the external issue, and I think we can still use this kind of the open image because open image is kind of the reference in our development how we can adapt this kind of this integrated system in to be as become our reference to develop this open JKN model of that can simulate our various system, but still integrate with OpenIMIS. So and but how? But that's why we try to figure out how to make it as a single system. So I think for example, we try to start with the enrollment module, for example. So as we know that in OpenIMIS there is a single module about the enrollment, but in this our application, this enrollment is divided into three different system, which is PCare, Hafiz, Health Facility Information System. PCare is about the patient, how to say, maybe like how we reimburse the patient claim, and also the mobile JKN, which is try to when the first citizen try when citizen try to register the in at the first time, yeah. and and this is I think this is quite challenging because if we directly do the uh, adaptation these three different application into OpenIMIS directly, I think it's quite how to say we say we call it as complex adaptation, and also maybe open image itself will become the like we have a lot of heavy breaking change. For example, open image is open source, and if we do a lot of change in open image, then I think open image is not open image again. Yeah. So that's the kind of the issue that we deal. So what we want to do, we introduce the open JKN. This open JKNs try to first we try to integrate first our workflow into OpenJKN first, and then if for the next we can try to synchronize data between the OpenIMIS and OpenJKN. So our effort is try to first we want to integrate first into our style of or our framework first, this OpenJKN, but we try to want to sync between the OpenIMIS and also the OpenJKN. So this is kind of the architecture of the open image open JKN. So there is we have the open JKN back end and also open JKN front end. So open image also have the open JKN open image back end and also open image front end. We try to use the only open image back end to communicate with our database, to communicate with our back end, and we use our new OpenJKN front end. So for this case, open image, we try to only use this open image back end that communicate with our OpenJKN back end. Of course, we use the same database PostgreSQL, and also OpenIMIS and OpenJKN has also different part of open database, but still can communicate. So for example, for last Pak Gugu said that we have like this kind of OpenIMIS, OpenJKN, OpenIMIS, OpenJKN. Also, there's several system. That's what we want to do is that in this part, in this OpenIMIS and OpenJKN, we try to develop like this architecture, and also hopefully we expect that every system for the learning the universal health coverage in Indonesia can integrate can simulate to this system, but still, if the system uh, how to say still and be spared, I think we can still integrate using or still communicate or make it interoperable with Fire. So yeah, I think the main point is that OpenCKN is additional module in OpenIMIS that bridge various check-in system via Fire. That's the main point. So also we already develop we still continue to develop the UI. So this is our UI for the enrollment. So this is the login and register page, and also there is how to enter the how to say the the injury, and also there's some also some interface to display the what the what injury pay and so on, and also this is kind of the like dashboard. So it's still on also this is in Indonesia, because we try to simulate this open CKN to Indonesian student, right? So we use the Indonesia. So yeah, I think that's it for me. Not too long, but maybe hopefully you can get my point. So thank you. So next is Mbak Nisa, please.
Yeah, thank you, Pak Lukman. Thank you. Good evening, everyone. My name is Annisa. So I will now continue translate the concept that introduced by the previous speaker, by Pak Anis, Pak Gugu, and also Pak Lukman into a proposed learning scenario, specifically on how we use OpenJKN built on OpenIMIS can be used not only as a system demonstration tool, but also as a learning sandbox to help our students understanding how this JKN or our Indonesian National Health Insurance work in practice. Okay, so before OpenJKN, we had already introduced OpenIMIS to our master student at UGM. I think it's back 6 years ago in 2019 through an interdisciplinary approach, because we have a student majoring in health financing, health policy, and also health informatics. They learn how this insurance system work at a technical level. Specifically, we use OpenIMIS to demonstrate how the membership enrollment work in OpenIMIS, and also walk through the healthcare facility registration and verification. This approach worked well, especially to teach our student how this insurance workflow work. However, we find some important gap, like you can see here, like only 50% student feel motivated to explore OpenIMIS further after the course. So OpenJKN Sandbox is proposed to address this gap. So by embedding this JKN specific rules and scenario that already introduced by Pak Gugu and Pak Lukman, so our student can connect this logic or financing behavior within our universal health coverage. Okay, so the sandbox is actually designed for multiple learner groups. As you can see in the slide, at Universitas Gadjah Mada alone, we have our immediate learner is from our master student in health policy and management. And in 2025, we have 114 students. And out of these 114 students, around 44 are students that focusing on social health insurance and also health financing. Then we can extend it our learner to our undergraduate student at Faculty of Medicine, Public Health and Nursing, and also to our other study program from the vocational school that applied science in management information system. And beyond UGM at the national level, we have more than 4,000 health-related study program that we think that it will make OpenJKN suitable as a shared national learning infrastructure. And you probably already familiar with this kind of OpenIMIS service flow. So our OpenJKN would like to simplify the flow. So we will only focusing on the top layer, which focus on the patient visit hospital for health service. So it's more on the enrollment student. Okay, so this slide is just to show that our OpenJKN is different. We have a different user role, unlike OpenIMIS. We have primary care and also referral facility of hospital, and at the national level, we have BPJS Kesehatan as the payer level. Okay, so I will start with the first scenario. The first scenario will be focusing on the JKN enrollment and segmentation. So in JKN, segmentation is not just administrative. So you can see here that we have 6 different type of payment segmentation. So we have subsidized contribution recipient, also non-wage earning, also wage earner member, and each of this segment will determine who pay the contribution and then how someone is enrolled in the system and what service they are entitled to based on the segmentation that they have. So the key learning message here is like we would like our student to learn how JKN segmentation directly shape the financing system behavior. And at the second scenario, we'll be focusing on the service access, benefit, and also facility rule. So you also probably already aware with this ecosystem of Indonesian national health insurance that introduced in the previous webinar by Pak Anis and also Pak Lukman. So OpenJKN will show how the user assign in which primary care facilities and how the referral eligibility to the hospital and also how their access can be denied if the payment status is inactive or if there is some class mismatch. So our student can immediately see message like whether this the facilities will be covered or it require referral or for example it not covered under the current class. So we hope that the scanner can help learners understand that coverage is conditional and even under universal health coverage. And this is our third scenario. The last one is related to the membership update and also interoperability. So this scenario 3 will introduce our student that insurance payment is much more on the real life dynamic. So OpenJKN can simulate how the segment transition, how if the user changing their, for example, changing job or move domicile, and or they miss their payment, so they can become inactive. There will be a penalty or re-verification process that need updating on the system. So we hope that this scenario can describe how change in status can affect the JKN membership. Okay, so to evaluate the learning impact, we would like to try to adopt the Kirkpatrick's 4-level of evaluation framework. At the first level, we have reaction. It's much more focusing on the usability and perceived usefulness of the system. And then in the second level, it will be a learning phase. It means that how accurate and how conceptual understanding our learner has. And at the third level, we have behavior. It's much more onto the application of rule in scenario. And then the top level, we have result. But for our OpenJKN sandbox, in the first phase, we will only focusing on the level 1 and also level 2. We hope that this can answer how OpenJKN is not just interesting tool or innovative tool within the health financing system, but also educationally effective for our student. Yeah, following Pak Ani's suggestion, we also trying to align the scenario with the Bloom taxonomy level. So our learner can progress from the first level, from remembering what is, for example, JKN segment, and then they can understand the contribution rule based on the segmentation, payment, and then third, they can apply them in the scenario that we can try in OpenJKN, and they can also analyze the problem based on the for example the scenario that we provided. And in the fifth level, we hope that our student can also evaluate the policy impact on this kind of system, and the top level, we hope that eventually they can create improvement ideas. So it can allow customization by program interest of our learner. And this is our, sorry. So this is our roadmap. We have 3 phase of roadmap. At the first phase, it will be focusing on the integration into course level module at Universitas Gadjah Mada. And then the second phase, we will try to introduce OpenJKN to other university, for example, to Association of Indonesian Public Health Higher Education Institution as a shared national learning sandbox. And at the third phase, we hope that our proposed scenario can become a dedicated health information system module focusing on JKN literacy. So the vision is for our OpenJKN to evolve from a teaching tool into a national learning infrastructure for JKN system literacy. And yes, to close, we would like to invite participation from Indonesia, participants who attend in this webinar, whether you are a JKN member or health practitioner or even academic or even a student, you are welcome to contribute to the next phase of OpenJKN Sandbox Learning. And we will also like to invite our OpenIMIS global community to provide suggestion on how whether this innovation or the scenario that we propose is working well, or if there is any other alternative method that we can try. I think that's all for the presentations. Thank you. Then I would like to return to Cha.
Yes, thank you, Ms. Nisa, Pak Gugu, and Pak Lukman for sharing your work with the AeHIN community. We'd like to invite our participants, if you have questions or maybe reactions to the presentation, feel free to raise your hand. The mics are enabled. You can also send your questions through the chat. Yes, Sir Jai.
Thank you. I'm currently unable to turn on my video, but my question is regarding the compatibility mapping that was presented by the team. So we could see to a large extent, there are gaps in terms of compatibility. So my question is it because of very specialized local requirements or the workflow? Because like OpenIMIS is kind of it's a public digital good, and then it's kind of widely used. So it should ideally have all those that is required for a global workflow. So in this case, when there are incompatibilities, like what exactly, why is this a large extent of deviation, I would say? Is this because of the local requirements? Because it happens, like I have been involved in the hospital information systems implementations when certain workflow or certain requirements from a particular facility is very specialized and it is developed, the software is developed that way, then of course it may not meet a global product or something that is kind of widely used elsewhere. So how does it, I would like to have that explanation for a large extent of gaps in terms of compatibility. And then of course it was mentioned it can still be used as a reference. Thank you.
Okay, Sergey, maybe I can answer your question. So yeah, I think there is a part of OpenIMIS that still can be used, yeah, because but most of the data, yeah, you're right that there is a special our ecosystem is kind of there is special have the special, how to say, special data, and also maybe uh also the workflow in itself. So I think it's yeah, I think maybe Pak Gugu or Mbak Annisa can also add up on this matter, yeah. But I think when we try of course there is kind of the general that can be used, but there is some part that we found that there is most data that not we cannot we said not compatible, but there is not exist yet in our uh, JKN ecosystem, yeah. So for that I mentioned before.
Yeah, thank you, Pak Lukman. Yeah, I think, yeah, you're right, Jay, because we noticed that our social health insurance is quite complex and expands every year since 2014, and there are many changes, not several, many changes happens, including a new workflow and also new variables needed for virtual claims or to check eligibility of the participants, for example, because thus the type of the participants, whether the participants supported by governments, central governments, local governments, or supported by as an employee or self payment. So there are several variables that requires that very specific for Indonesian context. Yeah, if there is any suggestion related to the how we can elaborated this into the open image, yeah, it would be useful for us to synchronize the business process in the context of Indonesia with the open image.
Thank you. Actually, one way of looking at it is like if your process is like means if this existing system works very well and there is no large means further requirements that are actually like kind of pending or gaps that are pending, then like if the system really works well and then people do not actually modify that. But if there are requirements that are coming up, that is because of course there will be some that may be coming up, but by now usually to a large extent the workflow will be stable and the requirements are kind of like don't change too frequently. There could be some tweaks here and there depending on the policies and adaptations for that. So if like a global SRS, like systems requirements are actually done, and then if the existing system meets, that's a different thing. But if there are still gaps and then you want to use OpenIMIS as a reference, probably are you in a position to actually eventually port the entire gamut of different applications into something that is global? That is a question for, of course, the people who are at the decision making level. Because to port everything to another system also takes time, effort, money, and then also there are issues with respect to change management.
Thank you, Sir Jai and Pagugu. We have a question in the chat. So, how are the stakeholders onboarded into OpenJKN? And is it free or do they need to pass through an eligibility check process?
Yeah, I think Pa Lukman will explain more about the OpenJKNs. Yeah, the OpenJKNs is expected to be like small additional modules to accommodate the several business process that's not currently available in the OpenIMIS, but still should be linked to the OpenIMIS. We haven't any what exercise yet for the OpenJKN, but basically how we at least two or three business process like participants administration or managements and health facility managements and interoperability with and also interoperability with the electronic medical record for a claim process or for monitoring of the accessibility and also the quality of care. So that's what the three things that we thought currently. So Pak Lukman, maybe you can add more.
Okay, Pak Guru. Thank you for the Mr. Alvin ya. So I think is it possible ya? But we still is under development about the OpenJKN. And also we focus on several case study, for example, the enrollment. First we try to in our enrollment, and if we already finish this, and also we can sync into OpenIMIS, even though not all the data can be synced. Yeah, maybe we can try how we collaborate to using the how to say higher labs for this case for this case. Yeah, yeah. I think this is quite good opportunity. Thank you.
Thank you, Pak Lukman and Pak Gugu. So maybe for our last question from Dr. Alvin. So is it possible for OpenJKN and FireLab.net to interoperate? For example, a patient in OpenMRS in FireLab to submit a claim to OpenJKN.
Yeah, I think it is also among the idea for the sandboxing. So currently for the primary care information system, we uh, we will invite the local SIMPUS or Puskesmas information system. I think similar to OpenMRS or other system like BAMNI and others. So that during the sandbox, we will explore how the communication or data exchange between the existing health facility information system into OpenCKN and then with OpenIMIS. Thank you.
Thank you, Pa Anis. To officially close the program, may I call on our Executive Director, Sir Jai?
Thank you, Cha. I would like to thank all the speakers for this very interesting webinar. I think we had several things coming out of this, and then as I understand, it's also an ongoing activity, and there will be more things to come. So we will be happy to learn further and do keep us updated. I think this is a journey, and then I think we will get there. So thanks a lot again for speaking to us and sharing the work that is happening in Indonesia. Thank you.
All right. Thank you, everyone. Thanks for
you.
joining us.